with bipolar disorder? A few? Okay. My mom was officially diagnosed with bipolar about 15 to 20 years ago. Ever since her senior year, she started turning to wild moods from very high to low. And as time progressed, they would just start getting worse and worse. Once she knew why, she started taking her medication day to day like she was supposed to. However, she would start feeling like herself, and she, like all bipolar patients who started feeling like they were okay, would stop taking their medication. And until one day she just stopped taking it altogether, and it was pretty much all downhill from there. I remember a lot of horrific things that she ended up doing to my two older sisters and myself when she was on an insane rampage of rage, and then the next day she would be my mom. The court decided it would be in our best interest to live with my father until she got her life together and she would start taking her medication. My mom, as long as she takes her medication, is very smart and can be quite successful. There are a lot of stigmas with mental disorders, and society needs to realize that these people cannot help it and they need all the help that they can get. Whenever I read magazines or journal articles, I notice articles to do with bipolar disorder. According to the National Institute of Mental Health, bipolar disorder affects approximately 5.7 million American adults, or about 2.6% of the U.S. population aged 18 and older, in a given year. The average age for onset of bipolar is 25 years old. Today, I'm going to explain to you what bipolar really is by defining what it is and its symptoms, by telling you the possible causes and what treatments are available. First, I would like to define bipolar and explain some of the symptoms. According to Benjamin B. Lay, who has a PhD in psychology in his book Psychology Introduction, defines bipolar disorder, formerly called manic depressive psychosis, as periods of mania usually alternate irregularly with periods of severe depression. Lay goes on to define mania being a disturbance of mood in which the individual experiences a euphoria without cause that is characterized by unrealistic optimism and heightened sensory pleasures, known as a manic episode. Pretty much what bipolar is: a manic episode and depressive episode. That's the two differences. The manic is very high, and then the next day the person can experience a very low, which is depressive mode. It can go on for weeks, it can go on for months. It does differences. Alright, this is the disclaimer before I give you the symptoms. Do not diagnose yourself. If you feel like you have any of these symptoms, see a professional. Some of the symptoms of a manic episode are increased energy, activity, and restlessness, unable to concentrate well, little sleep needed, unrealistic belief in one's abilities and powers, poor judgment, spending sprees, extreme irritability, a lasting period of behavior that is different from usual, abuse of drugs, usually with cocaine, alcohol, or sleeping medications, denial that something is wrong, and provocative, intrusive, or aggressive behavior. The National Institute of Mental Health describes a manic episode as diagnosed if elevated mood occurs with 3 or more symptoms most of the day, nearly every day, for 1 week or longer. If the mood is irritable, 4 additional symptoms must be present. Now, some of the symptoms of a depressive episode are lasting sad, anxious, or empty mood, feelings of hopelessness or pessimism, feelings of guilt, worthlessness, or helplessness, decreased energy, feeling of fatigue or being slowed down, restlessness or irritability, sleeping problems, change in appetite and or unintended weight loss or gain, and thoughts of death or suicide and actual attempts at suicide. The National Institute of Mental Health says the depressive episode is diagnosed if 5 or more of these symptoms last more than a day, nearly every day, for periods of 2 weeks or longer. The next thing I would like you to know are some possible causes of bipolar disorder. The most known are usually either biological or environmental. There is no exact cause that is known for bipolar disorder. However, to me, the most common sense would be biological. It is the most heritable of all mental disorders, usually passed with the same genes through the generations, obviously. According to Benjamin Lay's book, there is credible evidence for environmental factors that the countries in which people eat the lowest amounts of seafood have rates of bipolar disorder that are 5 times higher than in Taiwan, Korea, and Iceland. the countries in which the most seafood is consumed. This and other evidence suggests that omega-3 fatty acids, which are abundant in fish, may play a beneficial role in neural transmission and protect against bipolar disorder. These new findings may lead to a breakthrough in our understanding of bipolar disorder. However, we must ask ourselves, should we take them seriously? Lastly, let us overview the treatment and medications available for bipolar disorder. The most common treatment is lifelong therapy with a mood stabilizer. The most common one known is lithium, often in combination with an antipsychotic medication. Although the medication therapy for bipolar usually must be lifelong, the majority of bipolar patients are non-compliant and stop taking the medication after a year. According to Philip W. Long, MD, usually treatment results in a dramatic decrease in suffering and causes an 8-fold reduction in suicide risk. At a 4-year follow-up of bipolar patients, 41% have a good overall outcome and 4% have died. Women with bipolar lose, on average, 9 years of life expectancy, 14 years of lost productivity, and 12 years of normal health. Today I've taught you the basics of what you need to know to understand bipolar a little bit better. By defining it, by listing some of the symptoms, giving possible causes, and what the treatment is. My mom has gone below hitting rock bottom. She has lost everything she owns and all the money she has. She is currently located in a mental hospital in San Diego. I hope that she finally realizes that she needs the help they have to offer. I hope that one day the stigmas can be done with and we can realize as a sane society that those that are suffering from mental disorders need all the help that they need and that they receive it.
All right, on the structural issues, I think that the audience survey is okay. I think your story is a little bit more dramatic and might work better as an attention device. The thesis statement is very clear. Your preview, you're rushing through it a little bit, and so it wasn't as distinct as it could be, but as you get to the individual points, you make them relatively clear. Although it does sound a little bit mechanical as you get through the speeches, I think you need to work on those transitions and the labels of the points a little bit more so they come out more gracefully. You're kind of at the awkwardness stage instead of the skillfulness stage. And at the end of the speech, I appreciated the dramatic conclusion with the example that you started us off with. I thought that was fine. And good content on the speech. On the visual factors, I'm kind of assuming that you're sitting because of the medical issue that you had. Otherwise, it seems a little strange. The gestures, there are a couple of descriptive gestures, but the because the note's in the hand, I think you're really constrained. Your facial expressions, I think you need a little bit more variety, and it needs to be connected to the material. You may not have a naturally expressive way of interacting with people, but you need to work on it a little bit more. And one of the things with your voice I'm going to mention is I think that you've got a pretty narrow range that you're operating in. One of the places where I think you could maybe get a little bit more effectiveness in your voice is maybe changing some pacing. That would be maybe the easiest thing to do. I thought you looked at the audience pretty regularly, again, as much as you could given the notes that you're dependent on. You project your voice fine. Like I said, I do think that your voice tends to operate in a very narrow range. Everything is very clear when you're speaking, but your energy level, maybe your pacing, some appropriate pauses, those things, you sometimes sound like you're just plowing through the information instead of giving us a chance to absorb it, or you're having some emotional connection to it. Maybe the best place that you did have some connection to it was in the end of the speech. There aren't a lot of anxiety issues in the presentation. The time's used really effectively. I thought the content was very well developed. like I said, you need to work on the presentation issues a little bit. All right, thank you.